In this week's Cardiology Countdown, at the number 3 spot, an important study reminding us and our patients of the importance of continuing aspirin. This was an observational analysis done in the national database in the United Kingdom that looked at patients who were given aspirin for secondary prevention and compared those who had recently discontinued taking aspirin as compared with those who continued. And they found there was about a 1.4-fold higher risk of cardiovascular death or MI in those who had recently discontinued aspirin with about a 3-year follow-up period. It was mostly due to an increase in the risk of MI, but an important reminder of talking with patients about continuing aspirin. But this week's number 2 spot is a study that's quite intriguing, looking at use of soy or milk protein as a potential dietary intervention for hypertension. This was a randomized, controlled crossover study of 352 patients looking at use of soy, milk protein, or carbohydrate supplementation in addition to a standard low-sodium diet. They found that either of the two protein supplements lowered blood pressure by about 2 systolic and 1 diastolic as compared with the carbohydrate-based diet. This was no difference between either soy or milk protein, but suggests that we should be thinking protein in patients with high blood pressure. So an intriguing new study. And at this week's number 1 spot is the ISAR Test 5 trial. This looks at 2 new stents. One is a polymer-free stent that's this group, the ISAR group, developed with dual-drug sirolimus and probucol-eluting stents in a porous metal. And this was compared with the Resolute stent, a zotorolamist new generation stent. And the two had 1-year follow-up and had similar rates of cardiovascular death, target vessel-related MI, or revascularization over a 1-year period, and similar rates of stent thrombosis, about 1% in each of these two groups. And so this is further evidence in about a 3,000 patient trial that a polymer-free stent may be a way to have good outcomes. No difference seen here, but excellent outcomes overall. And so further progress in the stent realm. So with this week's Cardiology Countdown, I'm Chris Cannon.